Live. Local 2 News this morning starts now.
All right, 2 new studies show that CAT scans may expose people to more radiation than first thought, and they could be leading to tens of thousands of new cancer cases each year.
Researchers say 1 in 270 women and 1 in 600 men who have heart scans at the age of 40 could develop cancer. Janet Choi tells us about alternatives to CAT scans.
Leslie Rodriguez has had a fever, swollen glands, and extreme exhaustion. Doctors are using scans to try to figure out what's wrong.
I've had approximately 5 scans over the last month and a half.
But now, 2 new studies may have patients questioning the safety of CT scans. Researchers found that computed tomography scans can involve much higher doses of radiation than originally thought and could lead to new cases of cancer. Data shows that number could be as high as 29,000.
I don't want patients not to get the CT scans that they need, but we've also started to use CT scanning for much smaller reasons.
CT scans are becoming more common. 70 million tests were conducted in 2007 alone, up from 3 million in 1980. Radiologists argue that no one really knows the absolute risk of developing cancer from radiation.
The relative risk of you developing a cancer because of that is extremely low.
Scientists are trying to find new alternatives that expose patients to less radiation, like this new scanner called the Flash CT. Doctors at NYU's Langone Medical Center say the new technology is much faster and reduces radiation doses up to 90%.
Okay, here we go.
For Leslie, getting answers is the most important thing right now.
I need to have the test, and like I said, to gamble upon my health now and what might happen, this is the safer option.
Doctors agree it's important to weigh the risks, but they stress the benefits can be life-saving. Janet Choi, CBS News, New York.
All right, let's talk more about these alternatives to CT scans and how researchers are working to lower radiation levels.
Joining us live in the newsroom is Dr. John Feller. Dr. Feller is currently the medical director and founding partner of Desert Medical Imaging in Indian Wells. He is also the MRI consulting radiologist for the Desert Orthopedic Center. Dr. Feller is one of only 2 radiologists in the Coachella Valley to achieve Level 2 cardiac certification in coronary artery imaging. Good morning to you, Doctor.
Morning.
Doctor, let's talk about CT scan radiation overdose. The reason we're also doing this story is because in LA County there were dozens of people who were exposed to radiation overdose. Talk a little bit more about what you guys are doing here in the Valley.
Well, first of all, there's a few things we're doing. One is by trying to keep the newest technology on board with our CAT scanners. These new techniques help to reduce the radiation dose. In addition, making sure that these scanners all have quality control programs that make sure that the image quality is appropriate and that the dose is appropriate. Lowering the dose, we know, lowers the risk associated with this test. Then all of our sites have a board-certified radiologist that helps the referring doctor decide what's the most appropriate test, because sometimes we don't need to use the CAT scan to answer the question. We can answer that question with ultrasound or with MRI. In addition, there's new software that's coming out that actually reports the radiation dose that the patient received during the test, and that can be put in their report. And soon that's going to be able to actually be followed so that we can look at the cumulative dose that the patient's got, and that will be tracked in their electronic medical record here in the near future.
In your estimation, what are the biggest risks of excessive CT scanning?
Well, we know that the main risks are radiation-induced cancer. The risk is extremely small. The specific types of cancer are lung cancer and breast cancer. A lot of this data is actually extrapolated back from the data that we have from Hiroshima and the atomic bomb, so we don't really know that it directly applies to the relatively low radiation dose that we get with CAT scanning. But the risk is, we know, very, very small. You talked about 29,000 new cancers out of 72 million CT scans in a year. That's 4 per 10,000. But even though it's small, obviously it's a tragedy if it does happen, so we try to minimize that risk using, the techniques and approaches that I mentioned earlier.
Yeah, and Doctor, at Desert Medical Imaging, you guys have a heart CT scan that uses 80% less radiation. Quickly, we got to go. What happened in those cases in Los Angeles? Who's responsible for the overdose?
Well, the preliminary investigation suggests either that the protocol was either inappropriate that was entered into the scanner, that's the technique that's used, or the technique that was in the scanner was used inappropriately by the technologist that was performing the examination. Either way, it's obviously a tragedy that I think we've all learned a lot from.
Dr. John Feller, thank you so much for joining us in studio. Obviously, very, very interesting stuff that we all need to keep in mind. Thank you so much for being here.
You're welcome.